Hello everyone, once again welcome to my Oet channel. Today I came with one case note. So this is the case note of exam on 28 January 2023. So this is a real exam question, but some content maybe it is not the same like our original exam, because these all are the things it from student also have written the exam. Anyway, we will see an overall idea about the case note and we will see the sample letter also. So we will start with the note. Always, I just want to remind you, whenever you will read the case note, read it properly. Start with the notes which they have given in the starting point of case note. Then you can go to the writing task. Then you can start with the beginning. So this is the way you have to read the case note. So we will just start with the note. There you will get the idea regarding your role and about the patient, and of course you will get some information regarding patient's full name and where he is admitted and how long he has been admitted, or how long you are taking care of the patient. Some informations you can get from there. So here they have given that you are working as a nurse in high dependency unit and one of your patient is Mrs. Jane Handwicke. So she is 66 years old, and now you are sending the patient, the patient is getting discharged today. Then now you can go to the writing task. In the writing task, actually they have given the information that write a letter to Mr. Antonio Assis, Manager Physiotherapy Center, Crichton, for providing rehabilitative care for Mrs. Jane Handwicke. So from here we got the point that the reader is physiotherapist, that is the manager of physiotherapy unit, and you are requesting rehabilitative value, that is rehabilitative physiotherapy service. That means like a long-term rehabilitative services. Now you can start from the beginning. So here you got the point that patient name is Mrs. Jane Handwicke. Date of birth they have given 9 November 1956, and if they have given the age, always prefer the age 66 years. And this is not a non-case, so you have to go to all social paragraph. They have given patient is married, retired clerk, one daughter, lives with the parents, then ex-smoker, and her alcohol consumption is 10 to 14 units per week. So if they have given ex-smoker, ex-drinker, means no need to write it in our letter. Then next is the medical history. They have given patient has had asthma since 2010, diabetes from 2019, and on inhaler and metformin 500 milligram TID. Then next we are going to the patient's current admission. Patient got admitted on 19 December 2022, presented to ER with unconsciousness because patient had a fall at house, and they have confirmed it is hemorrhagic stroke. Surgically they have corrected with the coiling procedure because there was ruptured cerebral aneurysm. Actually, we are writing the letter to physiotherapist. No need to write many medical terms. Like in a simple way, you can present it in the present medical paragraph. You can mention the surgery name, but no need to mention in detail about the medical condition and the surgical procedures what involves in that. Post-operatively, patient was shifted to ICU. Then prophylactic antibiotic they have started. So these and all no need. Actually, we can write post-operatively she was managed conservatively. So that's enough for physiotherapist. Then they have given the scenario on 22 December 2022, that is excessive fatigue and memory loss. This is a subjective data from the patient. Objective data is decreased speed of speech and left hand weakness and shaking, inability to pick up and grasp things. These are all important for physiotherapists. You have to give more concentration on these points related to patients' mobility and what all the ability issues, and what all assistive device they are using, and what all things we have started, what all things doctor has prescribed. These everything we have to include in detail in this type of letter. So we can write decreased speed of speech, left hand weakness and shaking, inability to pick up and grasp the things, decreased sensation to left toe, decreased stability of left side, tremors, and unbalanced when standing and walking. So these are the condition of the patient. Then on 30 December 2022, patient got shifted to high dependency unit where we are the charge nurse. And here patient became normal. Patient started to become brighter in mood, and her cognitive functions became improved, and but patients still have left leg instability. So they have started physiotherapy. So already they have started. And on 1st January 2023, patient shifted to stroke ward, and this physiotherapy already is there. It's continued, improved stability, but patient unable to speak large words. But patient is compliant with the physiotherapy exercises. So still it is continuing. And 5 January 2023, walking aid needed. So patient started with the stick for mobilization. Then patient has undergone stair test, which was successful. So these all tests and this mobility gradual improvements all are important for the physiotherapist. Then patient felt bored and she requested discharge back to home. And but on observation, still patient is not improved. So we need to continue the physiotherapy at home. So that is the reason why we are writing letter to the manager of physiotherapy unit. So 7 January 2023, that is today's date, patient is planned for discharge, but patient is getting discharged with the family assistance for daily living activities. And recommendations are occupational therapy assessment for a week, request home visits for physiotherapy to improve rehabilitation, and plan is continue physiotherapy to home. So here they have given family assistance with the daily living activities, occupational therapist for assessment for the patient, okay, for a week. So he can come and assess the patient's ability, and if there is any assistive device means he can teach everything, but it is related to occupational therapist. Actually, no need to write this point in an active way, but you can write in a passive way. How we can write? Please note, he is getting discharged back to home with the family assistance for daily living activities, and he has been arranged with an occupational therapist assessment for a week. So that is a passive recommendation. Active recommendation here, we are requesting a continuous rehabilitative physiotherapy at home. That is only the thing it's needed for the physiotherapist, but you can include occupational therapist and family assistance also with the please note. So this is like just information we are giving to the manager. So this is the content of the letter, and only they are mentioning here it's rehabilitative. That means they didn't give a time period. Rehabilitative means for a long time until patient regain her strength, and when she can do her activities without assistance, they can continue. Until then, they can continue the rehabilitative physiotherapy. So this is the overall content of the letter, but I don't know whether there will be any mistakes or errors or differences in the words or phrases or something. But anyway, we had a quick review of the question paper. Now we will see the sample letter. So before going to the sample letter, I will just conclude. This patient had a fall at home, and patient when came to hospital, some of the signs and symptoms was there, so that all things he can write. And after the diagnostic evaluation, they confirmed it is ischemic stroke, and she has undergone the surgery. Post-operatively, she was in ICU, then high dependency unit, then stroke unit, then patient is getting discharged. During this time period, patient had many problems related to this mobility and speech difficulty, then balancing problem. So these all things we have to mention. Then gradually she has started with physiotherapy, mobility, everything is ongoing, and she is compliant with everything. She is cooperative with every physiotherapy sections, and she is getting boring. She is the one requested discharge back to home, but doctors advised for the continuation of physiotherapy at home. So this is the reason why we are writing the letter to the physiotherapist. So this is the overall content, and now we will go to the sample letter. Yeah, now we will see the sample letter. So here we will start with the date 7 January 2023, and the address is Mr. Anthony Aziz, and manager physiotherapy unit. Then after completion of this address, complete as per the case note, you will write the complete address. Then, dear Mr. Aziz, regarding Mrs. Jane Handwicke, age 66. If there is date of birth and age, always prefer age. Then we will go to the introduction. I am writing to request home visits for Mrs. Jane Handwicke, who underwent coiling procedure secondary to ischemic stroke. So that's enough. Then we can write, he requires rehabilitative physiotherapy sections from your facility following his discharge today. So today is the one discharge date, means you can just write, they have mentioned that today is the discharge date. So you can write following her discharge today. So introduction is, I am writing to request home visits for Mrs. Jane Handwicke, who underwent coiling procedure secondary to ischemic stroke. That I and S ischemic stroke, that first letter should be caps lock. And she requires rehabilitative physiotherapy sections from your facility following her discharge today. Okay, so this is the introduction. Then we will go to the present medical paragraph. Mrs. Handwicke was admitted to the hospital on 19 December 2022 following a fall at home. Then she has undergone surgical correction on the same day. Then postoperatively, she was managed conservatively. So no need to write antibiotic analgesics or anything, because this is the letter to the physiotherapist. So no need to write anything else. You can just write postoperatively she was managed conservatively. Then during hospitalization, you can just start with the complications. During hospitalization, she was noted with excessive fatigue, memory loss, decreased speed of speech, left hand weakness, decreased sensation in left toe, tremors and unbalance when standing and walking. Then we can write full stop. Then you can write subsequently, comma, she was transferred from intensive care unit to high dependency unit for better care. Then in the next paragraph, you can write gradually, comma, Mrs. Handwicke made progress with the cognitive functions, comma, however, comma, she has left leg instability, comma, therefore, comma, she has been commenced on physiotherapy sections. Like that you have to write, because here we have to write about the progress in cognitive function, but there are some problems regarding the instability and mobility issues and all. So she has been started. Here you should not write she was started, because continuously we are giving physiotherapy, and hereafter also we are writing a letter for the continuation of physiotherapy only. So you have to mention has been commenced on or initiated or provided with the physiotherapy. Then the next sentence we can write, also or additionally or in addition, she has been provided with a walking aid and her stair test was successful. Then we can write today she is ready for discharge, or else you can write today she is said to be discharged. However, she requires continuous or ongoing or follow-up physiotherapy sections at home from your facility. Okay, for her betterment, for her well-being. Like that we can write, no problem. Then you can write this is the reason for her referral. So this is the way you have to write this present medical paragraph. So gradually she got like progress, but still ongoing physiotherapy is required. So that is the just overall meaning of this paragraph. Then we can go to the social paragraph. In this social paragraph, no need to mention regarding old history in an elaborated manner, just you can concise. So Mrs. Handwicke is married and a retired clerk. She drinks alcohol 10 to 14 units per week. She has had medical conditions such as asthma and diabetes since 2010 and 2019 respectively, and on regular medications. So that's enough. Okay, because they have to know if the patient has any ongoing issues or not. That's only the thing. Or else no need to write the medications dosage and all, no need. Then the last paragraph, actually we don't have any more recommendations here. Just as I told you earlier, you can just write like this. It would be appreciated if you could continue rehabilitative physiotherapy sections for Mrs. Handwicke at her home. if it would be appreciated if you could continue rehabilitative physiotherapy for Mrs. Handwicke at her home, full stop. Then we can write, please note, she has been arranged with an occupational assessment for 1 week. And another one more thing, and she is getting discharged with the family assistance for daily living activities. So like that, you can just conclude the recommendation paragraph. Please do not hesitate to contact me if you have any queries, and if the physiotherapist name, if it is given, you can write yours sincerely, and if it is not given, you can write yours faithfully. Then you are the registered nurse. Then we can conclude. So this is a sample letter. In this way, you can just conclude. So if you are getting any letter to physiotherapist or occupational therapist, like non-medical cases, means always keep it in your mind. Don't use more medical terms, but you can just concise the sentences, medically or conservatively managed. So that's enough. But you have to give concentration for their mobility issues and their exercises, then their gradual improvement, currently what is their problem, and what is the doctor's recommendation. These all the things these all are the important points you have to mention in the present medical paragraph. And the same social paragraph also, no need to write regarding the medications in detail. You can just mention the disease conditions and on regular medications. That's enough. And in the last recommendation paragraph also, you have to see, according to the reader's scope of service, you have to select your recommendations and you have to prioritize. You can write, or same like this, occupational therapist and family assistants are required. These are all things you can just mention, like please note, kindly note, or off note. So that's enough, because these all are non-medical cases. It's not same like doctors and staff nurses letter. So in this type of letters, you have to think what is their scope of service, that what is their job, so what they need to know. Irrelevantly, don't write any data. You will lose your B score if you are adding more medical terms and medical histories and all. Just you can concise and you can write the letter. So I hope this explanation is beneficial for you. So if you have any queries, you can either message me in Telegram group, and the link is given in the description, or in the Facebook also. I have one channel. It's like a chat platform. You can just message, and I will try to give you advices with my knowledge. Okay, so we will see with another one informative video. Until then, bye. Take care.